And so how myths versus facts works, for those of you that are new to the show, I say a statement, and then our panelist says either myth or fact, and then gives a few sentences why it's a myth or a fact. But again, as I mentioned at the beginning of the show, we want to make sure that we're clearing the air. There's a lot of misleading information out there about health, and health a lot of times can be very difficult to navigate. It can be frustrating at times. But when you're working with a professional team, we can help you get to your goals and help set the record straight. So here it is. Myth versus fact, stroke 101. First statement, here we go. This is the Dr. McCoy. Myth or fact? All right. Here's a statement. If stroke symptoms resolve after a few minutes, there is no need to seek medical attention.
Myth. And hopefully we made this one pretty clear. If the symptoms are resolved, we're still very, very concerned. We would much rather see you and sort it out. So if it resolved, that was a big warning sign. It's time to come in.
I'm going to say triple myth. I'll take your myth and raise it a couple times.
Perfect.
Yeah, very much so. Thank you, Dr. McCoy. Here we go, Dr. Spencer. Myth or fact? Here's a statement. Strokes only happen to the elderly.
That's a definite myth.
All right, please explain.
We covered this earlier. There are certain strokes that we just can't predict for any reason. There are certain people with health conditions that haven't presented yet that put them at increased risk of blood clots happening, causing a stroke. And again, I'll say it, 25% of strokes happen in people under the age of 65.
Well, that is a very powerful one, and I was asking that statement on purpose because I wanted to see if I can tease that out of you again, because that's such a powerful number. 25% of strokes happening under people under 65.
I just want to jump in quickly,
please.
Just to highlight this point that it's not just older people. I have a friend of mine who would be the picture of health, younger than I am, had a stroke.
Wow.
In fact, when I got the phone call and I said that I don't believe it, and then I listened to the story and I talked to the physician and I thought, yeah, this is absolutely a stroke. Unfortunately, this person recognized the symptoms, paid attention, went immediately to an emergency room and was taken care of. So it's not just theoretical.
Yeah, we all know somebody, whether the patient we care or somebody that we know through our lives and everything. So thank you for clarifying that, gentleman. All right, here we go. Dr. McCoy, here we go. Myth or fact? Stroke recovery is a lifelong process.
I'm going to go fact. And I would say the reason why, and I feel jaded, because the last time I was on this, I think they're all myths. But I would say fact.
I know they were all myths last time. I got to switch up what you guys a little bit.
I would say that one is a fact, that stroke is a lifelong recovery process. And the reason being just what you got to earlier. Yes, there's a big recovery phase at the beginning, but after 1 year, it doesn't mean we should stop. People should remain active. They should keep paying attention. I would consider it to be lifelong in the sense that we are trying to reduce your risk of the next one. That's one of the ways you recover from the first one. So I would say it's lifelong in that smoking should remain. You should quit smoking lifelong. You should look at diet. You should look at exercise. You should look at these things that should continue well after the stroke that you've had. So your stroke care doesn't end 365 days after your stroke.
All right, here we go.
If I could comment on that.
Please go right ahead.
Quickly. So I know we mentioned earlier the point of maximum recovery is that year after the event, but we tell this to surgery patients too. Yes, that's the point of most rapid recovery, but there's a lot of things can happen after that too. Matt mentioned plasticity earlier. There's other things you can learn. Just being more aware of your deficits and what's experienced over time, you can get better at dealing with that. So certainly the year is not the end.
All right, thank you. Here we go. Dr. Spencer. Here's a statement. Strokes are painful.
Myth.
All right, please explain.
Pain is one of the least frequent symptoms of a stroke, and Matt would agree with this. So most people have neurological symptoms with no pain. I would say only under circumstances where, say you do have a hemorrhagic stroke or you have severe swelling of the brain, it can irritate the tissues around the brain, and that's where it can cause pain or headaches. But I think, or if you have a fall from your stroke and have a distracting injury, but I think rarely are they painful.
Excellent. You know what? I think I want to participate in this a little bit. I don't think I participated last time when we did the concussion show. So here we go. I'm going to get on this too. Here we go. Here's a statement. I like this. Why not? Here we go. Myth or fact? Here's a statement. When you experience stroke symptoms, you should go to your family doctor ASAP. That is a big, fat myth. You need to go to the emergency room ASAP, activate 911, call emergency medical services, and go to the emergency room. Your primary care physician is not equipped to handle an acute stroke symptom. There we go. I like it. Here we go. Here we go. Dr. McCoy, here's the next statement. All right. Family history of stroke increases your chance of stroke.
I would say it's certainly something that could increase your risk of stroke. So I'm going to go fact.
Okay.
If there is a very strong family history, it's something we should certainly pay attention to. Maybe the reason you have a strong family history of stroke is maybe you have a strong family history of hypertension, diabetes, high cholesterol. Maybe you are genetically susceptible to the risk factors for stroke or for stroke itself. So paying attention to your family history is a good idea. And recognizing that there's a strong family history, we really better pay attention to the modifiable risk factors.
Excellent. Here we go, Dr. Spencer. Here's your statement. Small strokes do not need to be treated.
Myth.
All right, please explain.
So, as we've discussed a couple different times, so small strokes, I think TIA falls into that category. They can be a harbinger of much, much worse things to come, and also some of the smallest strokes, if placed correctly, can be some of the most devastating.
All right, thank you. Here we go, Dr. McCoy. Stroke is a disease of the heart.
That's a pseudo myth.
Pseudomyth, okay, fair enough.
Stroke is a brain problem that can come from multiple places, but certainly someone who has heart disease, if there's problems with the heart, the brain can potentially suffer. As a neurologist, I would say the role of the heart is to provide the brain with blood and oxygen. So if there's a heart problem, atrial fibrillation has been mentioned, coronary artery disease, those are risk factors for the blood vessels in the brain. So individuals who have heart risk factors also have brain risk factors.
All right, thank you. You know what, and I totally forgot, I probably should have asked myself that question because I said I was going to participate with you guys. So here we go, I get the next one myself. Here we go. Here's a statement, and I'm going to give my answer. Up to 80% of strokes are preventable. I will say that's a fact. We're talking about lifestyle at the end of the day, and lifestyle being one of the biggest reasons for people getting themselves into strokes. If we reduce the modified risk factors, including reduction in smoking, eliminating smoking, I shouldn't say reduction, eliminating completely, controlling diabetes, making sure blood pressure is controlled, make sure body weight's controlled, moving more, eating better, and stressing less, I think we can actually do a lot of good movement and momentum in preventing stroke. All right, we're going to do one more. Here we go. Dr. Spencer, this one's for you. I like this one. Okay. At best, taking aspirin will do nothing to cure an ischemic stroke. At worst, it will make things worse during a hemorrhagic stroke. Aspirin.
I'm going to have to say there's some truth to that. And it's one of the points that, I'm glad we touched on, because it is purely ischemic stroke. It probably isn't going to hurt anything. Honestly, in a hemorrhagic stroke, an aspirin, especially in 81, it's not a huge risk to cause a hemorrhagic stroke to get worse. It usually will contribute a trivial amount to that, something whereas Plavix is much more potent. That's something you probably don't want to give in a hemorrhagic situation.
All right. You have any comment on that one, Dr. McCoy?
And this is going to be more of an inside joke for one of my former residents, Karen, who's at the University of Colorado, and Jorge, who's now at the University of Chicago. Aspirin is always the answer. Whenever you take a stroke lecture, aspirin's always the right answer, even if it's maybe not, but they'll appreciate that. Whenever I go to stroke conferences, there's lots of discussion, and in the end you're like, well, you do give the patient aspirin. So aspirin is a benefit for most strokes.
All right, thank you. There you guys have it, myths versus facts. All right.